The question is not why are we in a deficit? The question is how to prevent us from digging the deficit again and again. How can we, with those 200 billion euros we spend for 67 million people living in France, how can we provide the best quality of care, the best, and the recipes are quite clear in my humble opinion. For example, we never have had a prevention policy as it is in some countries. We provide healthcare to everyone. Okay, that's very democratic. That's normal in the French philosophy. But how do we prevent some people among the providers or among the users of the system to cheat and to take more than what they ought to do? How can we make the best possible use of these 200 billion euros we spend annually, which is more than 3,000 euros per inhabitant? It's far enough to provide everyone living in this country, including illegal immigrants, who are entitled to get free medical care as they are entitled to get free education for their children in this country. And we can be quite proud of that. How can we, with this large amount of money, 3,000 euros, provide them with the healthcare support they need from their birth to their death, including the fact that since I was born, the life expectancy in France has increased by almost 20 years. And of course, the number of senior people with chronic, long-lasting disease and all the impairments that are happening when you are getting older is increasing. So the demographics has changed, the medicine has changed from prevention to diagnostic and to treatment. Oncology, the specialty of Julien Taïeb, has incredibly changed in the last couple of years. How can we adapt this system for which we spend a lot of collective money together? Our friends in the United States, when you're rich, you can have some of the best medicine in the world. But when you are not rich, then you cannot access that medicine. Fortunately, in Europe, fortunately in France, you can access the best level of medicine, whoever you are. But how can we maintain this high level of medical care? And this creates the pleasure and the pride of being in the healthcare system I mentioned earlier. And we want our patients to be happy together with us, to be proud together with us, and be sure that as long as they live, they will be provided the best level of what progress, technicity, and research are providing to the healthcare system all over the world, because now the medicine is worldwide, and what is discovered here is to be used everywhere. So we don't want French citizens to be deprived of any innovation just for the sake of saving money.